From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
October 15th was the first annual meeting of the medical bloggers at the Blog World Expo in Las Vegas. Dr. Val Jones helped to organize the event and has been an outspoken champion for social media covering healthcare. And she joins us now live this morning with how social media and blogging in particular is changing how doctors, nurses, and their patients communicate. Great to have you here, Dr.
Great to be here.
Having healthcare professionals blog on the World Wide Web seems to me the logical extension to all the let's be honest crap that is out there right now that is passing for medical information.
Dave, I got so frustrated with patients coming to me with printouts from the internet that had false information in them. You know, don't take your vaccine, all you need is garlic. Colonics will cure you from every possible disease, and they bring them to me, and I thought, okay, I've got two choices. I can continue to have them bringing these, or I can get out there and create a blog and give them good information and help them understand what's really true.
How do you pick what topic? Because it's obviously, almost endless about which you can write. What moves you on the blog daily?
I think it's news related. If there are topical things like H1N1 and sort of debunking some of the myths that are out there, urban legends are great to debunk. So it really sort of depends on what's hot.
And you touched on one of them, and we can do some of that right now. It is almost impossible to go on the internet at some point and not have your mailbox flooded with colon cleansing ads. And it is an unpleasant thing to think about, but it is a completely worthless notion.
It is worthless. It's actually can be harmful too, so people need to be aware of that. And so the best thing to do is to go online, find a trusted source of information, potentially a medical blog like mine at betterhealth.com, and check out the information that credible sources give you about them.
In some ways, you're swimming upstream, it would almost seem. What's the reaction been so far?
Well, people really appreciate getting accurate and good information, and in fact, blogs have saved lives. Dave, I don't know if you're aware of this, but it's not just about counteracting misinformation, but getting out information early. It takes a long time for things to percolate through journals. And sometimes people can get early information about cancer therapies that can help them.
And this is a classic example of how these networks exist in a lot of ways. There are cancer survivors, families of cancer patients, and I'm just talking about cancer there. Just about any chronic disease that you can think of has similar networks that people should become part of, because they too are interested in getting the truth and don't have an agenda to push. You have to be your own healthcare advocate, and this is now how you have to do it in 2009, it seems to me.
That's right, and there is a good housekeeping seal, so you can be sure that that a blog is credible. It's called the MedBlogger Code of Ethics. If you see that on the bottom of the blog, you know that it's been peer-reviewed and that the blogger is exactly who they say they are.
And there it is, getbetterhealth.com. Great website right now, MedPageToday.com, a number of places that you can find this information. And also check out Dr. Val's blog. She's the CEO of Better Health, and she's a frequent visitor, and we look forward to it. Thanks so much.
Thank you, Dave.
We've got news from medicine's cutting edge after the break. And